you, Nick. Morning, everybody. I'm actually the lead technologist in this. So there's Dallas, well-known city in Texas. And so this program that I'm going to talk about now is delivering assisted living lifestyles at scale. So there again, that's me again. I'm Graham Worsley from the Assisted Living Innovation Platform, and I work for an organisation called the Technology Strategy Board. So what we're talking about, though, is some of the things Stephen's talked about is, that there's been more pilots in this space than British Airways. And British Airways has, I think, more than 3,000 pilots. Have we actually had more pilots than British Airways in this space? We may well have done. But what we need to do now is to drive forward at scale, or to fly forward at scale. So how everything fits together. Stephen's mentioned the whole system demonstrator, and before that we had the preventative technology grant as well. So Dallas, therefore, we think is the next stage of evidence with even more users than we've had before. Before I go to talk a bit about Dallas, though, most people here, this is a different audience to the kind of audience we usually speak to, because the Technology Strategy Board as an organisation is very much an industry-focused organisation. We face industry. We're about wealth creation in the UK. So when we were talking about the Dallas programme, we did realise that what we needed to do is not just talk to our usual suspects, the people we speak to all the time in industry and business and so on, but then we recognised to talk to the health and care professionals as well, which is why we're here today. So Assisted Living Innovation Platform, what we do, the headline aims are to make enable greater independence, but above that, I think in terms of assisted living, the challenge that was actually laid down by Tim Ellis 2 or 3 years ago when we set this thing up is to make the technology cheaper and better. And then the additional strapline is we realise as well we ought to make the technology more desirable. So that's what we've mostly been about. If we look at all the different things that we've done, the first thing we actually did was fund technology research and development. That's what we are. We're the Technology Strategy Board. So we've pumped in a fair old amount of money into funding technology R&D, and those projects are now coming to a state of maturity. When we also set the program up, one of the things people said to us was, look, it's not about the technology at all, it's about the business model. So how do you change the business model? So we've also got some research projects, mostly led by universities, looking at how you change the business model. It took us a while to get there, to set those things up, but we've now got a large-scale program of activity doing all the different things that you need to do in this space that then we think comes together, culminates in Dallas, which is delivering assisted living lifestyles at scale. So that's a quick bit of background for people who aren't actually kind of our usual suspects. So we're then thinking is, that Nick just talked about passing the baton. And so we think this is the next step after the whole system demonstrator, which was, after all, a randomised controlled trial. So the first point I think that's important for Dallas, and things that make people smile who were involved in the whole system demonstrators, is that Dallas is not a randomised controlled trial. So that's the first point, and that we want to move to what we think is the next order of magnitude. So that if we think that the whole system demonstrators this smaller number of people in the low thousands, what we need to do is 10,000 plus per Dallas community. So we've developed a kind of series of new language around what Dallas is going to be. So Dallas started off as a demonstrator, but Stephen pointed out, look, we've done demonstration. It's not about demonstration, it's about delivery. So Dallas is about delivering assisted living lifestyles at scale, and it's the next step in what we think is a culmination. So what we're thinking is that Dallas is going to be 3 to 5 communities of at least 10,000. One of those communities will be in Scotland, because we've got part of the 23 million that Stephen mentioned, 5 million of that has come from Scotland. So one of our activities will definitely be in Scotland, and I'll say a little bit about that shortly. So it's about innovative assisted living, and it's about services as well as technology. And the service element of this, as we know, we're going to have service change, organisational change. So you've actually got to have innovation in services as well as innovation in technology. It's also about well-being, and it's about top quality health and care. So that's the kind of background to what we're doing. The way we work is that it's an open competition. So it's an open competition. We want all types and sizes of organisations, public, private, third sector, and that includes funding charities and social enterprises as well. As I said before, one community will be in Scotland. One of the things we discovered when we went to Scotland, there is actually a place called Dallas in Scotland that makes whiskey, which is in the north of Scotland. So this again, adds to our momentum around what it is that we're trying to do. So I don't think there's anybody from Scotland here, is there? Quick bit of audience participation. No, there isn't. Right, okay. So in Scotland, slightly different process. The Scottish Government want to work with their own community in deciding which public sector bodies will be involved in Scotland. So they're going to identify the public sector bodies in Scotland. All other organisations within Scotland apply using the same process as the rest of the UK. The competition is now open. Anybody who's not actually seen the competition document, it's the paper version is actually outside on the table. It's a UK-wide programme. The funding is 23 million, but 5 million of that is from Scotland, 18 million of that is primarily from the Technology Strategy Board, but there is also some residual funding from the Department of Health, National Institute for Health Research. If you want to participate, you have to register by the 20th of July, and that's the web address for registration. All these slides will be made available afterwards, so you don't need to write that down. And you register by the 20th of July, and the closing date for applications is then the 27th of July. That's the kind of summary schematic, if you like, of the Dallas programme, because we've got the 5 sites there, A, B, C, D, E, the 5 Dallas communities. I'm slipping into the old language, it's Dallas communities. We need to see inter-site networking and improvement between those sites. Alongside that, we've got 3 separate activities which will be core funded centrally by ourselves and will run as separate activities. The first one will be evaluation, and we will do some cost-benefit analysis. What we're not, because this is not a randomised controlled trial, again, we're not going to the level of the evaluation that has been done by the whole system demonstrator, because that has been done. We don't want to repeat things that have already been done. Technical interoperability has been the thing I've spent most of the last 6 months working on, and how we define that and what we do with that. So there will be guidance issued before, we hope by September, on what we're expecting in terms of technical interoperability, and we'll be publishing a paper on that. We will then be monitoring interoperability and the achievements around interoperability throughout the length of the programme. The social element of this, the personal element of this, is also very important to us. So there is a separate group as well, also looking at lifestyle issues, and that will again produce something, we think, before the programme is getting into the kind of next stage, and that will be available as well. And with that, so lifestyle part of it is also important to us as well. The Dallas scope, so that's the broad challenge. It's about improving quality of life, it's enabling people to live independently for longer, it's about products, services and systems, and it's about connecting communities. So those are the kind of things that we think we need to do. In terms of scope, if we think about how the whole system demonstrators developed, then the scope for the whole system demonstrator, most of what's gone before, has been around this long-term conditions agenda. What we want to do is go beyond that and expand beyond a simple kind of long-term conditions agenda. We want to look at wellness, we want to look at health and well-being and preventative issues. We're not just interested in the public sector, we want to think about private sector as well as the kind of harder technical things, we've also got the social things as well. So if we're looking at our scope, it's far more than just that kind of red box where most people have been thinking about what we're trying to do before. We want to expand beyond there. So the Dallas summary then is that it's £23 million investment, 18 million from us, 5 million in Scotland. Stage 1 is open to all. Again, we're not looking for pre-formed consortium at this stage, and I'm going to talk about how we're going to go through the process next. And there's no golden tickets in this as well, There will be workshops, so if you want to participate, if you're kind of thinking, right, we're going to do this, you will need to save the dates for the mandatory workshops. Again, a reminder then of what the registration dates, and then we have networks you can join to meet other people and share and get involved. I'm going to talk as well a little bit about the application process and guidance, because I'm assuming because you're here, you're interested in finding out about Dallas and potentially you want to get involved in this. So I'm going to talk as well this morning about the application process. So what we've got is we're talking Lego, right? Okay. So we think that there's a whole load of people out there who are Lego bricks, and they're the potential people who could be involved in delivering assisted lifestyles at scale. And you've got individual bricks. So the first stage of what we're doing is trying to identify those first Lego bricks. So that's the first stage, the first open application. What we're then going to get is when we're going to take people away to a workshop, and we think that a workshop is actually a box of Lego bricks, and those are the things we think we're going to need to build a house at this stage. These are the people who may well be firstly involved in building our house, our Dallas house. Stage 2, the next stage of the process, we're going to run facilitated workshops, and then you're going to start to get the bits and pieces that you're going to need to build a house together. So you've then got facilitated workshops, you've got a base, you know what you're doing, you know most of the people you're going to be working with. And then only at that stage, final stage in this 3-stage process, that's your house then. So you've got your full proposal, you've built your house, but maybe you're missing a bit. Maybe you're missing the garage off your house. You want a garage on as well. So within our process, there is also the pick a brick thing. So we've got people together. You can then go back and then say, okay, we need a garage on this. We can then go back, pull other people into the final stage through the process. So it's about Lego. So we're running this as a series of workshops. So the first application you put in, then we think then we'll probably get 200 or 300 of those initial applications, and that we'll then take people away and we'll run a workshop. And that workshop will take place on the 12th to the 15th of September. Those dates are in my diary, those dates are in Mike's diary, those dates are in my other colleague Jackie's diary, so we'll be there to do that. We'll then have a follow-up meeting in November, and then there'll be then a second workshop as we go through this process of what we need and what we look at, which will then take place next year. So that is the detailed timeline then. So that's the kind of process that we started on the 7th of June. This is going to be a process we're going to go through until the actual communities are finally selected, which will be in April next year. So what we're hoping is building people together, so that they're then able to build this house, which is this Dallas thing. So in terms of eligibility, we're looking at private, public and third sector organisations involved in this. Point to note is that all applicants must be a legal entity. Sometimes there's little groups that people have got together that aren't actually legal entities. So they're not going to be able to apply for this. You must have a legal entity that's going to be able to lead this. We also don't want universities applying for this directly. This isn't a research programme. We appreciate that there's a few people in universities who could be able to contribute to this, and that they may then actually become Lego bricks later on who you could build in and bring in to do something specifically. But we want to emphasise that this is not a research proposal, and that Dallas proposals must both look at interoperability and make significant advances towards technical interoperability, and also show that they're going to be able to improve lifestyles to promote health and well-being. So this is what anybody's looked at this. I don't know if anybody's looked at it already, what the application form looks like. It's only 5 pages. The first stage application is only 5 pages. We don't want a book. It's actually usually harder to write 5 pages than it is to write 50. Again, we know that. So we're going to try and get people only to write 5 pages and then independently assess those applications. So there's 10 questions on that form, and there's actually 10 marks for each of those 10 questions. So you have to fill the form in and you have to answer all the questions. And we've thought about it, and we think that's quite well balanced in terms of what we're going to be looking for and how people will be marked. And so it's CV track record, who I am, what I've been doing. It's about added value and where the benefits are going to lie in different sections. It's also then about a vision. So we don't want people to write proposals. We want people to actually say, okay, our vision, my vision for what you need to do and how this is going to work is going to be this. So again, I'd like to just repeat that it is now open, a UK-wide programme, so you've got all that well in, and then there is a competitions helpline there for people who want further information. And I think I'm going to finish there. Again, just a repeat of that slide. That's our networking slide. There we go. Okay, thank you.
Okay. Perfectly timed. We have about 10 minutes or so to gather questions. So from both Graham and also from Stephen. I will also look to the back to see if there are any tweets or questions as well. So please raise your hands. When you want to ask the question, please tell us who you are and where you're from, because this is being live streamed. Take the first question down here, please. Thank you. Second question.
Thank you. David Hogarth, and I'm from the Westminster Local Involvement Network, the LINK. I remember coming to the conference here in the beginning of March, and Stephen Johnson was here then, and I think I was asking about the whole system demonstrator project, whether it was covering mental problems as well as long-term conditions, well, long-term mental conditions like depression and dementia. And I think the answer was no, but I may be wrong. And I would like to know also whether Dallas, to what extent Dallas is going to cover these things, where it seems to me they're very likely to be great savings as well. Thank you.
Okay. I do remember the question, and you were quite right. The areas that WSD focused on was diabetes, COPD, and coronary heart disease. What I'm very clear of is that the intervention, or the approach that we'll have in terms of the evidence that we will get, will demonstrate that remote monitoring will support people with long-term conditions. I believe that will include any condition, and it'll work for those conditions, but we're specifically looking at those three.
On Dallas, the quick answer is yes. I think we'd be very interested and would welcome any proposals that come forward that consider dementia. Yeah.
And there is an evidence base on remote management of people with mental illness and depression, which we have on some of our evidence sites at the King's Fund. So email me afterwards, I can get you in touch with that. I had a question here from the lady there, and then over here.
Karen Down from FAST. This is a question for Stephen. I was encouraged to see that you've recognised the need for formalised shared learning and the potentially the need to retrain staff. A key way to engage health and social care professionals is through training and education. At the moment, we don't have any formalised knowledge and skills frameworks or national occupational standards for telecare and telehealth to underpin that training and education. What plans do the Department of Health have to invest in work by the sector skills councils to map those frameworks?
You're absolutely right in terms of that's a big area, and I think that's where we will start to see some changes. I haven't got any specific plans to tell you about today. I'm confident that we will be able to do something about that in the future, and I've had discussions with the Skills for Care and Skills for Health about this. But I haven't got any specific answers for that question right now.
I'd welcome the opportunity to speak to you about it.
Absolutely. You've got my details. If you want to contact me, I'm more than happy to speak to you.
Okay, thank you.
Hello, my name is Anita Hyam, and I wear various hats, but the particular hat today is the Oxfordshire Local Involvement Network, although I've also been in conversation with Oxford Technologies. Given, as I know from having observed the situation in Oxfordshire, that when people are, patients and service users, are faced with using the technological means of dealing with their circumstances, they're often very nervous because A, their circumstance, B, their age, and C, the lack of education in the formal sense that they will have had as to know what to do, and they feel it's more comfortable to be in the surroundings of a hospital with nurses and whatever, the things that they recognise. And I'd wondered whether for this program that if you were engaged with a large, successful supermarket chain that has already got the services, the skills, both in terms of making people feel comfortable, gets access to many thousands of people, and is already giving them selling food and clothing, and of course has pharmacies, whether that would be a means of giving reassurance to many people that it must be okay if they're in it, because they're not going to go in for something that's not very well. And it might also do something about the social responsibility badge for some of the major supermarkets. I know that Oxford Technology people have wondered about this as a way in of enabling the ordinary Mr. and Mrs. member of the public to feel that they are not being dealt with by Big Brother and it's going to be okay.
Okay.
We've had some discussions with retail organisations and the consumer market, but it's not easy for them, I don't think, to get involved in this. One of the barriers is actually around technology and interoperability. And so one of the barriers that's been mentioned to us by one of the large pharma companies, one of the large chemist organisations, has been that. The retail organisation I have spoken to, and who are involved in one of our projects, those are Co-op. And the Co-op, I think, have an interesting business model, because they are the fourth largest pharmacist in the UK. They have a bank, they have an insurance business, they also actually have some residential care as well.
And a funeral service.
And I didn't want to mention that. So there are possibilities there. The large pharma companies as well have also been interested in this as well. And the way we've tried to attract those organisations is in fact through our research programmes around business modelling. And I think we'll be interested to see if any of them actually do then bite the bullet and apply for Dallas.
Okay, thank you. Had a question at the front here, and then one here.
Marlene Winfield from the Department of Health Informatics Directorate, and mine is an allied question, which is how in your process of selecting the people for Dallas are you going to ensure, given the clear direction that the white paper liberating the NHS has taken us into patient control, how are you going to ensure that these pilots actually meet the health and well-being goals of the patient and not what other people think should be their goals?
Good question. I'm not sure I know the answer to that. What we do set up, though, is an independent assessment process. So we will not be responsible for deciding. I will not have any personal input into the Dallas sites or the Dallas communities that eventually come out of this. We will look for advice from colleagues on the left and from the Department of Health in terms of meeting what the requirements are in the white paper. And it may be that's one of the things that we'll look at further down the line. At the moment, we're kind of fairly safe in that the first stage application just is who you are, what you do, and what your vision is. So that's one of the things we can probably pick up when we get to our first workshop stage. So I'm passing the book forward a little bit, but it is definitely the kind of thing you need to think about and look at.
Okay, I mean, it's an interesting question. At a large conference we had in March, the conference finished with a user talking very much about the disconnection between the users of the service and actually the design of the service. There's something there to consider, I think, which is at the heart of your question. We'll take two more questions. Richard down the front, and then we have Brian at the back for the two more questions. So Richard.
Hello, my name's Richard Stubbs. I'm working with the East London Foundation Trust, and I was on the whole system demonstrator as programme manager. First of all, apologies to Graham for this one, because this is one of those detailed questions that comes from going through the application form. And I have a problem with it. The declaration, section 7, says the applicant is expected to have discussed the application within their own organisation, company, and any other body whose cooperation will be required to deliver the project. Now, I love the SBRI process, this whole way of reforming the kind of network of people that would deliver the project through the process of the SBRI. But I don't see how that ties in with the declaration, unless perhaps the FAQ is done, where it says that it has to allow participation rather than anything else. Can you clarify that for me?
this on to Mike in a second. One of the things that came from the whole system demonstrator, and one of the things Tim's stressed to us as well, is that you need to make sure you've got buy-in at the top level of an organisation as well. And so that's part of the process that we want to make sure is there, so people have to be signed up to that. And so you need people at the decision-making top end who've got control over budgets to say, okay, this is something we probably support. Was that your question?
No, I'm afraid it wasn't. There was no problem with that. It's the any other body whose cooperation were required to deliver the project, which seems to be a contradiction
I will
between...
pass that back to Mike at the back then.
Yes,
Mike,
Brian.
just before you have a question, can Mike respond on behalf of the TSB, and then we'll finish with a question from Brian. I understand there are problems with the mics, which we'll try and pick up in the second half. Mike.
Hi, Mike Biddle here to try and help. Part of the reason for the possible confusion in that Section 7 declaration is it's actually us copying from previous competitions that have run under SBRI, which actually require people to submit a detailed proposal of what they're going to do. So we've actually sort of slightly changed the process with this particular Dallas competition, so that might be the reason. So when you're signing that declaration, you're basically signing to say you want to be involved, you have the buy-in from your organisation to do that. You don't have to form that collaboration at the moment. That's just sort of a bit of a remnant of the declaration that's been used from the previous forms that we've used in that space.
Okay. There's a comprehensive answer to the question. I did see a phone line with a helpline as well. I'm going to maybe use that. Brian, last question to you.
Yes, Brian Longman from Croydon Telecare. There's been a lot mentioned about interoperability of, and I assume the way you're talking about equipment providers and sensors and care units that can go on together. One of the big problems that, if we look at the London boroughs, in London boroughs, 32 of them, they've all developed their own types of operating systems of how they install and work together. And we're starting to get a system where we've almost got areas that are providing services that other areas don't provide. And I think it needs to be within the Dallas commitment that we're looking at interoperability of systems and processes as much as we're dealing with equipment.
Yeah, no, I'd agree with that.
Okay, we're all agreed. So on that basis, we're just past 11 now. So now's the time to take a break. I know that both Graham and Mike will be around to take further questions about the Dallas programme over coffee. So this is the Opportunity Network for the next 25 minutes or so, and we'll reconvene here at 11:30. But to Stephen and also to Graham, thank you very much for your presentations and information. Thank you.